Hi everyone, I'm now live. I've never done a live video before, so this is my first time. Please bear with me as I'm learning as I go. Let me know if there are any issues from your end. Thank you so much for those of you that texted me, messaged me their questions, and thank you to the rest of you for joining my live. Hi everyone. So the reason why I'm doing this live is because every day I get a handful of questions from pre-dental students all across Canada and even the US asking me a lot of the same questions. You know, they want to know more about how to go about writing their personal statement, how to increase their chances of getting into dental school, how to study for the DAT, what to do with their prerequisite courses, extracurriculars, and those sorts of questions. And a lot of the times these questions tend to repeat themselves from one person to another. So I thought I would do a live where I would come on here and answer some of the most commonly asked questions from pre-dental students. And you know, afterwards, for those of you who are not able to join this live, I will post this video on my profile, and you know, hopefully you can all benefit from it and spread the word. So for those of you that don't know me, a little bit of background information about myself. My name is Roshan. I'm from Vancouver, and I did my undergrad degree in kinesiology and health sciences at UBC in Vancouver, Canada, and I had a gap year, and then after that I started my DMD, or Doctor of Dental Medicine, degree at UBC also. So, you know, I basically did all of my education here at UBC, and to be honest with you, I don't regret it. To go over why people always ask me, why did you choose kinesiology and health sciences? So when it comes to choosing your major, I've had a lot of people ask me, what should I do? You want to make sure that you do something that you're interested in, because if you pick your major to be something that you're truly interested in, then you're more likely to study, you're more likely to do well in your courses, you're more likely to be you know, motivated to do more, to be more involved, whether that be community or just doing better in your courses. So I always tell people, don't pick something that you think is going to sound really good to the admissions committee, because the admissions committee won't really, to be honest, care what you did for your undergrad. All they see is basically your GPA for your courses and for your major and for your prerequisite courses, and they're not going to be like, oh, this person did physiology, that sounds better, or this person did pharmacology, that sounds better. No, that's not the case. So for me, when I was in high school, I thought that I wanted to do science at UBC, because everyone around me, my older sister, everyone was doing sciences at UBC. So I thought that was the way to go, because I would always see people who did, you know, science, who did a science degree, would end up in med school or dental school. But for me, I was always a swimmer growing up. I did a lot of swimming. I know a lot of people wanted to know what extracurricular activities I did. So I was a competitive swimmer. I had a number of shoulder injuries, which ultimately prevented me from swimming competitively anymore. So from that point on, I became really interested to know more about the human body and basically you know, what happens in a physiological on a physiological scale when you get an injury. And I wanted to basically go more down that route where I could learn more about sports and physiology and everything sports related, because that was basically my interest was. And that's why I switched, you know, when I was in grade 12, I switched my application from going for science to going for kinesiology and health sciences. And to this day, I'm actually really, really grateful I did that, because kin was really, all of the courses were really interesting. They were really relevant to what I was interested in. You know, I would say if you do sports in high school, if you do sports in undergrad, you know, kin is honestly the place to be, because you learn a lot about the human body, you learn a lot about anatomy, physiology, sports psychology. Everything kind of has that sports flavor to it. So I was really glad that I actually ended up choosing kinesiology over sciences, because as you know, science is a very huge program, so the class size tends to be a lot bigger, whereas kinesiology was much smaller. We were a cohort of just over 100 students, and we were forming study groups where we studied together, and there was a sense of community, which really helps, especially in first year when you've just, left high school and you've come onto university. That can be a huge, almost a culture shock, if you will. So yeah, so that's why I always tell people that you want to see what you're interested in, whether that be chemistry, physics, math, arts, whatever it is that you're interested in. You want to choose that rather than what your friends are choosing or what you think is going to sound really good to the application, to the admissions committee. Because at the end of the day, like I said, they will see what your GPA was for all of your courses in your major, and then they will also separately look at the prerequisite courses. Now, in terms of the prereq courses, obviously that varies. There's about 6 English-speaking dental schools in Canada, and they all tend to have very similar prerequisite courses, as you know. So a lot of them require biology, chemistry, OChem, physical chemistry, biochem, usually 2 English courses, and from what I remember, some of them require physics as well. And I'm not sure if some of them require psychology. I'm sure, you guys are more aware of the prerequisite courses. Obviously, you want to make sure that you do your research. You know what schools you're applying to, and you know what the prerequisite courses are well in advance. That's something that you want to be, taking care of from your end. Just be very familiar with all the prereq courses, so you're not in 4th year about to apply to a program, and then last minute you find out that, oh no, you haven't done the prereq courses. So obviously, you want to get into that. You want to make a spreadsheet for every school you're interested in, all their prereqs. Maybe look at some entrance statistics so you know whether you're in the competitive average zone or not. So that's something that you definitely want to do your research and put in the time, because it will obviously hopefully pay off. In terms of prereq courses, what I wanted to say was make sure that you don't fall behind. For me, people always ask, why did you decide to do dentistry? So I was actually, when I was in high school and even up until 1st year undergrad, I thought I wanted to do medicine. A lot of people in my family were doing medicine, so I had a lot of people around me, a lot of influence from a medical background, so I thought medicine was what I wanted to do. I knew that I always wanted to do something with my hands because, when I'm doing procedures, that's when I'm in my zen, that's when I'm the happiest and I'm the most focused. So I knew that if I went into medicine, I would have to go into something that, involved doing procedures. Obviously, surgery is the main one, but we all know the lifestyle balance is really, really tough. The other ones would be interventional, cardiology or radiology. So that was something that I was thinking about. I didn't quite know at this point when I was in 1st year undergrad. And I remember at the time you had to be, I don't know if this is the same, but when I was in 1st year undergrad in 2012, you had to be at least 19 years old to volunteer at a hospital. So as soon as I turned 19, which was towards the end of my 1st year undergrad, that's when I decided to volunteer at a local hospital. And I was just volunteering at the emergency department, and my job was mainly to speak to the patients that were waiting in the ER and speak to their family members and kind of keep them company. And, obviously my job was really basic, but I got to see how emotionally challenging and taxing the job of a medical doctor was in a hospital setting. And I found out that it's not really for me. It's not really something that I would want to do for the rest of my life. So that's when I kind of decided that, maybe medicine wasn't the right program for me. Obviously, it takes a long, long time. A lot of you guys, when you reached out to me, you asked me to talk about medicine versus dentistry. Obviously, my background is all in dentistry, so I'm not as familiar with medicine, but I am planning to have my husband do a live with my husband because he went through the medical program at UBC and he's doing his specialty now. So stay tuned. We'll go over the differences between medicine, dentistry, and all of that stuff in the next live. But long story short, end of 1st year undergrad was when I decided that medicine was no longer for me. And one day I was just chatting with my dad and he told me, well, you want to be in healthcare and you want to do procedures, so have you considered dentistry before? Dentistry was something that I'd honestly never considered before. It was, I didn't really know anybody who was a dentist. and I'd never shadowed a dentist before. It wasn't really something that I'd quite considered. So end of my first year undergrad, that's when I decided to learn more about dentistry. So what I did at this point was I basically went on the UBC dentistry website and I emailed every single professor at UBC dentistry asking if I could become a research assistant, volunteer research assistant in their projects, because obviously if you're a prof, you are involved in research, but then you also do a day of clinic somewhere. So I reached out to all 52 profs. Not a single one of them got back to me, with the exception of one of the profs who was a prosthodontist. So prosthodontics is a specialty within dentistry where they deal with, mouth rehab. So doing lots of implants and crowns and bridges and yeah. So basically she was the only one that got back to me, and she said that she had a project underway and she needed a volunteer research assistant. So I became involved with her. I started shadowing her at the BC Cancer Agency one day a week, and I was also at this point doing research on the projects with her, and it ended up being a very eye-opening and great experience for me, and I actually ended up staying on as a research assistant for 7 more years. So I actually ended up staying on as a research assistant until my last year of dental school. So, when people say what kind of extracurricular activities I should do, it's not, to be honest, it's not the best question to ask, because you want to see what you're interested in. You want to see what you're passionate in, because at the end of the day, what the admissions committee will want to see is your commitment, and obviously if it's something that is long-term, it's going to look a lot better on your application. So that's why you always, just going back to your major, you want to be authentic, you want to be true to yourself, you want to choose something that you're truly interested in terms of extracurricular activities, because if you're truly, genuinely passionate about something, you're more likely to stay on long-term, which is what the admissions committee is looking for, and you're more likely to do a better job at it, which will ultimately get you that reference letter that you want. So, don't do what you think is going to sound really good or look really good on the application, because what's the point of doing something if you're not interested in it? You're just going to resent yourself for going to your volunteer job, and you're probably not going to be motivated, which is going to show, and chances are you're not going to be committed to stay long term. So just make sure you choose something that you're interested in, and choose something that's long-term, hopefully, because if it's a short-term thing, special day activities, things like that, it's, again, it's not going to look really good on the application. So that's what I wanted to go over in terms of extracurriculars. Major, we talked about. Now the DAT, dental admission test, that's something that always comes up in terms of people asking how to study for it and things like that. So the DAT, obviously it has pretty much the Canadian DAT has the same components from when I took it, I believe. So biology, chemistry, perceptual ability test, reading comprehension, and the American DAT has organic chemistry and math in addition to that. So I took the Canadian DAT, and the piece of advice that I would give you for the DAT is you want to make sure that you do as many practice questions as possible. Just like with any other exam, it's one of those exams that, of course you want to do the studying the theoretical aspect of things, but you also want to make sure that you're doing a lot of practice questions. And I would say give yourself probably 2 full months of studying for the DAT. It's not an exam that you can wing. It's not an exam that you can just show up and do. It definitely takes some very specific preparation. For myself, I didn't necessarily find the biology and chemistry challenging, because I feel like, if you do an undergrad and you have to do those prerequisite courses, you're pretty well prepared. You just have to do a few practice questions to get your head around it. But the perceptual ability test was definitely one thing that was so foreign to me as it would be to a lot of undergrad students. It's very different from any type of courses you've done in the past. So I would say for the PAT or perceptual ability test, doing again as many practice questions as possible so you can just get used to the different concepts that they add, the different types of questions that they ask. And you also want to get your timing down. So I would say practice, practice, practice. There are a lot more resources nowadays than there used to be for me when I was writing the DAT. And I believe nowadays they have a restriction that you can only take the DAT 3 times. So, you know, obviously don't let that scare you or discourage you. I would just recommend that, you know, you put in at least 2 months of full-time studying for the DAT. And, you know, usually a good time to take the DAT is end of 3rd year, because at that point, chances are you've done all the prerequisite courses and, you know, basically you're more comfortable taking a lot of exams because you've already done a lot of exams at that point. So yeah, I would just say give yourself time. Don't be discouraged if you have to take the DAT. If you have to take the DAT more than once, you know, don't let it discourage you. Okay, so that's as far as it goes for the DAT. And then yeah, so as I said, for the perceptual ability test, lots of practice questions. And for the reading comprehension, I would just say you want to like read as much as possible. Obviously reading books, literature books, that's not necessarily going to be as helpful. For me, what I did was I downloaded a bunch of news apps on my phone at the time. I remember I had the New York Times app, I had the New Yorker app, and I would force myself to read as many articles a day as possible. Obviously, you want to make sure you're not reading articles that you're really interested in. Try to pick some articles that seem really dry and you're not necessarily interested in them, because the reading comprehension, it'll have a lot of passages that are very specific, and it's not necessarily going to be about something that's really exciting to read or thrilling, because at the end of the day, they want to make sure that you're able to read a passage that is super unfamiliar to you and you're able to comprehend it, understand it, and respond to the question. So I would just say read, and don't necessarily read things that you're very drawn to reading. Now, in terms of working on your application, I would say that you want to basically, as early as possible in your undergrad, when you start doing your extracurriculars, whether that be work experience or volunteer experience or shadowing or whatever it is, I would say make a big sort of roadmap or chart of all the activities you do, the names of the volunteer coordinators, their phone numbers, and if there's anything of interest that happens within those activities, such as, you know, if it was a day where you got into a conflict and you managed to resolve the conflict, if you learned a new skill, whether that be about yourself or just a general skill, you want to jot down these, you know, significant things that kind of stand out from every single one of these activities, so that when the time comes, when you're working on your application in 4th year, you know, you have something to refer to. You know exactly how many hours you did in this one particular activity, because, you know, you can imagine when you're in 4th year and you're trying to remember how many hours you worked at this place or you volunteered at this place, it's going to be very, very difficult. So one piece of advice I have for everybody is, you know, create a roadmap as early as you start your first job or first volunteer experience. Keep track of how many hours you do, keep track of the name of the volunteer coordinator so you can refer back to him or her as needed. You know, jot down anything that stands out, anything that you learned from that activity. Kind of keep maybe a reflection journal. That's going to be very helpful, not only to your application, but also when you're doing interviews for dental school. Hopefully they'll ask, tell us about a time when you got into a conflict and how did you manage to resolve that conflict? Tell us about a time when X. So again, that's why jotting down significant events from different activities is going to be super beneficial to you, because then you have something, you have an experience that was recorded to refer back to. So that's as far as it goes for your application. And obviously when it comes to asking for reference letters, you want to ask for reference letters from the activities where you managed to build rapport with the volunteer coordinator, and you know, it was something that was long-term, hopefully. Maybe you had some leadership component, so your application is going to be hopefully more effective. Now, in terms of shadowing, so I know that a lot of dental schools in the US definitely consider shadowing to be mandatory. So I would say with shadowing, it's not only, even if it wasn't mandatory for some schools, I would just say it's an absolute must, because unless you've shadowed a dentist or a dental specialist, then how would you really know whether this profession is for you? So, you know, when you shadow a dental professional, you're really able to see what they do day in and day out. You get to see how they interact with patients. You get to see the business aspect of things. So it's going to be very beneficial for you in terms of just really getting to see what a day as a dentist looks like. And basically, you know, if it's the right profession for you. Now, nowadays, especially since COVID, and even before COVID, it's very difficult to get a shadowing position. I always have people reach out to me asking if I'm accepting any shadowing students, and unfortunately, at our clinic, we're not. So, you know, what I found when I was going through, when I was an undergrad, was I was reaching out to a lot of, you know, as I said, profs at the dental school, at my local dental school, asking if I could shadow them. Because basically, if you're doing a job for that person, whether that be being a volunteer research assistant, or, you know, as I said, shadowing in a dental clinic is really tough right now. So if you can get into a reception position, or if you can become a chair-side dental assistant, then you're a lot more likely to, you know, get your foot in the door. So as I've said in my previous videos, there's a shortage of dental assistants in British Columbia, and I'm sure other provinces in Canada are struggling with that too. So what a lot of dentists will do is they will take, you know, somebody who's interested to be a chair-side dental assistant. So you wouldn't be certified, meaning you wouldn't be able to do some of, you know, some of the jobs that a certified dental assistant will do, but they will train you out of their own time to become a chair-side dental assistant. So not only would you be getting a shadowing, you know, the number of shadowing hours that are required, but you'd also be working in a dental setting. And to me, that would be a lot more valuable than just, you know, standing there and shadowing and, you know, maybe getting bored because you can't quite see what's going on. So I would just say, you know, if you can look into becoming a receptionist or becoming a chair-side dental assistant for the summer or every summer during undergrad, that would be a great work experience. That would be a great way to hopefully get a reference letter. That would be a great, you know, way for you to know, to assess whether this is what you want to do for the rest of your life. So, you know, shadowing is a must. And in terms of being a dental student, people always ask me, what does life in dental school look like? So life in dental school, I would say it's quite different from life as a pre-dental student. You know, when you're a pre-dental student, obviously you have so many things on your mind. You have to do really well on all of your undergrad courses, prereq courses, and you have to juggle extracurricular activities on the side and work on your application, and it can definitely be a very, very stressful time. As a dental student, obviously that's not stress-free, but it's a different kind of stress, because at that point, you know, you're already in dental school, so you know, that stress is at least off your shoulders. But at the same time, there are a lot of courses, there's a lot of content that needs to be sort of condensed within 4 years of dental school, because unlike medicine, at the end of fourth year dentistry, once you pass your boards and, you know, meet all the requirements for the licensing body, then you can start practicing as a dentist. You don't have to do any extra years doing your residency or specialty. So you can imagine the amount of information that has to be condensed into 4 years. So obviously in undergrad, when you're taking between 4 to 6 courses per term, in dental school you don't have, it's a standard curriculum, so you don't have any say in terms of how many courses you want to do per term. So I remember in first year you start out with 9 courses per term. So definitely it's a lot of information, it's overwhelming, but it does get better. For me, the most challenging year was definitely first year dental school, because, you know, as you can imagine, going from high school to first year undergrad, there is a huge transition that you have to get used to, and that's the same from fourth year undergrad to first year dental school. That's another huge transition. But the good thing is it's a smaller cohort. It's not like undergrad where everybody's sort of pursuing their own careers. Everybody's in the same boat in dental school. It's a smaller class. You can create study groups. There are a lot of like-minded people in dental school. So I would just say that you kind of have to, after first year, you'll get used to the idea of having a lot of courses and having a lot on your plate. The other thing I wanted to mention is in the first 2 years of dental school, there's a lot of medical courses, lots of heavy medicine blocks. You cover the different body systems. So, starting with GI and respiratory and neurology and all of that. So for me, what was really helpful for me was I really prioritized the dentistry specific courses, whether that be endodontics or prosthodontics or oral surgery, restorative, which is a huge part of dentistry, bread and butter of dentistry. So for me, I really tried to focus my energy studying for the dental courses as opposed to the medical courses, because for medicine, while it's really important for a general dentist to know about the human body, I knew that I didn't necessarily have to ace that. So, at the end of, after 2 years of dental school, you really start to get the hang of where you need to sort of expend your energy and your time. So, it's a learning curve, but it's something that will definitely come with more years in dental school. Now, a lot of people, life as a dentist, they want to know what that's like. So if you've been following my page for quite some time, you hopefully have a better idea of what life is as a dentist. I would say that, again, for me, I would say the first 3 years practicing as a dentist were definitely the more challenging years of being a dentist. For those of you that don't know me, I have been practicing as a general dentist since 2020 in Vancouver. I was very fortunate because my first job, it was a long commute. A lot of people, after they graduate from dental school, they move to rural areas, which is a great idea, because you go into a place where there's a huge number of patients and not as many dentists. So you get to see a large volume of patients on a daily basis, and you get to really improve your clinical skills in dentistry. You get to become faster, more proficient, learn more about the profession. So it's definitely something that I recommend. I didn't have that opportunity to go to a rural area because my partner was doing his specialty training here, and I wanted to be near he was. So I basically picked the next best thing, which was practicing in the suburbs of Vancouver. I was practicing in a clinic that was far away from the urban part of Vancouver, and my commute was obviously very long, but it was a very busy practice, and right off the bat I was thrown into the deep end. There were days when I was working on my own, so I got to really learn how to work independently, and it was a great experience because I got to do a lot of restorative and pros cases. So I would just say that once you graduate from dental school, obviously you're a safe practitioner, but you have to remember that you're just a beginner at this point. And just like anything else, practice makes perfect. You have to be honest with yourself. You have to really choose the procedures you do very carefully, and you want to make sure that you do a lot of continuing education courses, because I always tell people that the journey really starts at the end of dental school when you join practice, because that's when you actually have the ability to see what you're really interested in. So for me, people always ask me what my interests are. So for me, I'm really interested in restorative, cosmetic, and pros. So I obviously love doing the bread and butter of dentistry. A big part of my practice, as you can tell from my Instagram page, is educating patients and trying to teach my patients as much as possible about improving their oral health, the reasons why, and also I'm a strong believer in preventative dentistry and minimally invasive dentistry. So that's where a large part of my practice basically revolves around doing comprehensive exams, patient education, preventative dentistry, and then also restorative dentistry. So that would be, doing fillings or restorations, doing crowns, doing bridges. In terms of cosmetics, which I mentioned, I'm really interested in doing Invisalign and restoring sort of symmetry and natural beauty. And the areas where I'm not interested in are root canals and surgery. I try to stay as far away from those two as possible. It's just something that I wasn't quite interested in since dental school. And the beauty of being a general dentist is that you really get to choose what your interests are, and you get to really focus on those areas to become as great as possible in those areas. So I always tell people ask me, should I specialize or should I just stay in general dentistry? And for me, I feel like you really have to. You won't know in dental school. Dental school is too short a time, and you're so overwhelmed with the amount of information that's being thrown at you. You're just trying to survive, trying to stay afloat, and everything is just new information that you've never come across in undergrad or even before, even if you had a lot of shadowing experience. So for me, I think that you should give yourself a couple of years of practicing as a general dentist after dental school to really see what it is that you love doing. Because once you specialize, you pretty much end up doing that thing all day, every day. But for me, I knew that general dentistry was a path for me because I love how broad the scope of a general dentist is. And there's so many different procedures you can do as a general dentist that honestly, you never get bored. There's always something to learn. There's a lot to learn. And like I said, you get to really find out what your areas of interest are. Like for me, it's restorative, pros, and cosmetics, and you get to do a lot of continuing education courses in those areas of interest to hone your skills so that you can be the best dentist that your patients deserve. So that's my piece of advice for people that ask me for whether there are dental students that are joining me here. You just want to make sure that you give yourself time, and I would say if you can go practice in a rural area for a couple of years after dental school, then obviously that's perfect, that's great. You end up learning a lot and you become very comfortable with different procedures and you become very proficient hopefully at doing different procedures, and then you can move back to the city. Now, I saw a question about personal statements. That was a really good question. I hope you're still with me, the person who asked about personal statements. So a personal statement, I would say, is probably the most important part of your application. It's basically, they're asking you why you want to be a dentist. So what I always tell people is you want to make sure that you tell your story. And again, you don't tell a story that you think the admissions committee is going to want to hear. So, with the personal statement, you want to make sure that you basically let them know who you are. You give them an opportunity to see who you are. So I would just say, tell your unique story. You want to stand apart from other people. A lot of people, they, unfortunately, they use a lot of stereotypical or cliched statements such as, I want to go into dentistry because I want to help people. Of course, a lot of us, we all want to help people, hopefully, in our profession, whether that be dentistry or anything else. That wouldn't necessarily convince the admissions committee why dentistry, because you can help people as a nurse, you can help people as a chiropractor, there are different ways of helping people. So I would just say, try to stay away from those cliched or stereotypical statements. Again, tell your unique story. Use, an event, a milestone, a lesson, whether that was doing, a certain volunteer activity or a work activity or something that basically confirmed your interest, your passion in dentistry. So tell your story. Don't tell somebody else's story. Don't, use somebody else's story. Just really try to be authentic and true to yourself, because not only is that going to help you, not just getting into the application, getting into dental school, but also later on in life. So, I would just say your personal statement should be a way for you to really give the admissions committee a chance to know you. Okay. Now, in terms of the interview process, so hopefully by the time you've submitted your application, and we all know it's very competitive to get an interview, so hopefully, fingers crossed, you'll get invited for an interview. I would just say that for the interview, you want to make sure that you practice for the interview as much as possible, because as a lot of you know, a lot of the dental schools and medical schools in Canada and the US are now using the MMI, or multiple mini interview format. So basically, for those of you that have never heard of this concept, it consists of 10 stations. So there's 10 rooms. You go to the first room and there's a question posted on the door. The bell rings. You have 2 minutes to read the question and to think about what you're going to say. And then the bell rings again, and after 2 minutes, you go in and you have about 8 minutes to answer that question to the interviewer. Obviously, this is a very unusual situation to be in. That's why, you know, for those people that say, I'm just going to wing the interview, you know, I don't advise that. Obviously, you know, just like the perceptual ability test, it's something that you've never encountered before. It's something that is not natural to your everyday life. So it's not something that you can really wing it. I would say, again, for the interview, you want to give yourself 2 months, to really get into the habit of, you know, reading questions, thinking about it, coming up with different ideas you're going to talk about, and then going in and having that confidence, the tone of voice, the body language to be able to deliver a response to that question. So again, you want to give yourself 2 months to practice. And again, with the MMI, just like the perceptual ability test, practicing as many questions with as many people as possible is a great idea. So for me, the way I practiced was, I had a gap year, so I applied in my 5th year. And because I knew that if you applied after 4 years, then they would drop your lowest average year, I was pretty confident that I would at least get an interview for UBC dentistry. So obviously, at this point, I didn't even know I was going to get the interview, but I was like, you know, I better be safe than sorry. So I started practicing for the interview pretty early on, before I even knew I had an interview. And at first, I kind of started practicing just in front of a mirror or on photo booth. I would just record myself, and obviously at the beginning, you're not going to be very good. Don't be discouraged. It's not a very natural way of interacting with people. It's the multiple mini interview. It's somewhat unnatural. So, you know, be gentle with yourself, be patient with yourself. So I would say practicing in front of a mirror at the beginning or on photo booth, it really helps you build your confidence. You get to see if you do anything that is not exactly, you know, the way to go. If, for example, if you say you know a lot, or if you say like a lot, or if you a lot. So, you know, you learn a lot about yourself just by looking at yourself in a mirror or recording yourself. And once you get more comfortable at that stage, then you can start practicing with your friends, with your partner, with your you know, with other people that are going through the same journey. And, you know, once you build more confidence at that level, then you can go out there and you can practice with a lot of, you know, I would say with as many pre-dental or pre-medical students as possible. I was lucky because when I was going through the interview process, they were holding sessions. I think it was called the UBC Pre-Med Club at that time. They were holding interview sessions, MMI practice sessions on the weekends with med students and dental students, and I'm sure a lot of universities nowadays are doing that as well. So you want to make sure you join that. That time will not go to waste. I would say, you know, you want to practice as many questions as possible with as many people as possible. And again, you know, staying current with world events is very helpful because they love asking about world events and what's going on in the world, and they want to know your opinion. So again, reading articles, which I mentioned for the reading comprehension of the DAT, that's going to come in really handy for the interview process as well. And in addition to practicing the questions, it's also really good to kind of, I don't know if you remember earlier when I was mentioning logging all your hours for different volunteer and work experiences, and also you know, jotting down significant events that happened, lessons that you learned, doing some reflective journaling for different activities as you're going through them, because a lot of the interview questions tend to be personal. Also, they ask, tell us about a time when you had to display courage, or tell us about a time when you were discriminated against. So they ask very open-ended kind of personal questions as well. So you want to make sure that you have something to refer back to. So obviously, when you're going through a volunteer activity or whatever it may be, and you jot down significant events that happen, it would be much easier to remember when you're preparing for the interview. Now, in addition to that, I just wanted to add as an aside that my partner and I, so he was going through medicine interviews and I was going through dentistry interviews, and after I was comfortable on my own, we were practicing quite a bit. And at the time, honestly, there weren't that many good MMI questions or resources out there. So that's why when we actually got in, and when we were in our final year of dentistry and medicine respectively, that's when we decided to create an app that would really help pre-med and pre-dental students practice for the MMI or the panel interview. So our app, if you want to check it out, it has a free version as well. It's called Pocket Medical Interview. It's on the App Store and Google Play, and it has over 500 questions, practice questions in different categories of ethical, personal, and situation-based. So it's a really good way, and it also has a built-in timer, 2 minutes to think and 8 minutes to respond. So it's a great way of having access to questions that are out of the box. They're not necessarily those repeated questions that we see on the MMI, and it's basically developed and created by people who went through the rigorous process of getting into med school and dental school. So if you want to check that out, that's definitely an option available to you. And I think that was everything that I wanted to talk about. Thank you so much for sticking around, and I hope you found this information helpful. If you have any questions, we can maybe spend the next couple minutes going over some questions that weren't addressed during this talk. And as I mentioned earlier, I'm going to post this on my YouTube page and on my Instagram page, so hopefully those of you that couldn't make it, if there's anything that you can take away from this talk, that would be great. So just a couple minutes for any questions, maybe things that I didn't quite go over, any UBC specific questions or dental school specific questions. Okay. I think that is pretty much it. Thank you so much again to those of you that gave me your questions over the last week. I hope this was helpful. Okay, there was a question that just came. Were you involved in any research during your dental studies at UBC? So I don't know if you were here at the beginning of the talk. I started as a volunteer research assistant with one of the UBC dentistry profs in my second year of undergrad, and I actually really liked what she was doing, the research projects that she was doing, so I ended up staying on for 7 more years until the end of dental school actually. So I was involved. And does UBC dentistry prefer students who do their undergrad at UBC? So I remember at the time when I was doing it, 90% of the seats were reserved for in-province students. So that would be BC, anybody in BC. They don't necessarily give preference to UBC students over SFU or other parts of BC, but I do know that at the time at least 90% of the seats were reserved for BC in-province students. Please check the website to see for the most up-to-date, because I know every single year they're changing, and sometimes it's a bit much to keep track with all the changes. So make sure you stay up to date. What GPA should we aim for in our undergrad? So you want to make sure that you check the entrance statistics for different schools. That would give you a really great idea of knowing what the GPA requirements, the competitive GPA is. It changes from year to year. So again, I would really check different schools. What kind of research was it? So somebody asked what kind of research was I involved in. So the specialist that I was working with was a prosthodontist. So that's a specialty within dentistry that's involved. They do a lot of mouth rehabilitation, especially for cancer patients that have had part of their jaw removed. It's, you know, so it was at BC Cancer Agency, and her research kind of revolved around different outcomes for cancer patients. So I was involved in multiple projects. For example, one of them was looking at the survival of dental implants after people have received radiation to treat their oral cancer. So again, it was oral cancer or other types of cancer and their impact of radiation therapy on the survival of dental implants or dental crowns. So or looking at, you know, the side effects of the most common drugs that cancer patients are on. So it was very cancer heavy, which was great, and I really enjoyed doing research. I actually ended up staying on for 7 years. As I mentioned, even after I got into dental school, I kept staying on, and I actually ended up staying on until my 4th year of dental school, and I even managed to present my research findings at the International Association for Dental Research, which was a really cool experience. So as I mentioned earlier, again, for those of you that have just joined, and hopefully you'll get to watch this video in full afterwards, but you want to make sure that you pick something that you're interested in, whether that be for choosing your major, or if it's for volunteer activities, extracurricular activities. If it's something that you truly enjoy and you're genuinely passionate about, you're more likely to want to stay involved, and hopefully get an amazing reference letter. So, you know, at the end of the day, it all comes down to following your passion, following your dreams. Yeah. Okay guys, thank you so much for joining my live, for posting your questions, and I hope that this was a helpful little talk for you guys. Let me know if you have any other questions, and I hope that I wish you guys the best of luck for your dental career. Bye.